flowers and a cup of tea. Flowers over my head make me well, make me dead. You know it's been 18 years since I was 10, and sometimes I don't know how I got here. How did you decide? How did you decide to make?
My name is Megan Bayless. I've been helping with Women's Voices for the Earth to create this conference for you. And I'm here to introduce a wonderful woman named Linda Hightower. She's an RN at ONC, and she's worked for the past 8 years at Community Medical Center here in Missoula as a medical surgical staff nurse. She's a graduate of St. Patrick School of Nursing here in Missoula. She is also certified orthopedic nurse. Linda has a special interest in osteoporosis and has taken every opportunity to educate herself and the public about this silent disease. She's been published in Orthopedic Nursing Journal. And welcome, Linda.
I'm going to use this microphone because, as Megan and I just discussed, I used to be a night nurse, so I'm used to sneaking up on people, and sometimes I don't speak up enough. Okay, Megan, could you pass these out to everybody, please?
Yes.
Okay, most of these slides were put together by the National Osteoporosis Foundation. The foundation is the only organization in this country that is completely and totally dedicated to the eradication of osteoporosis. Everyday advances in healthcare help us live longer. I read an article the other day that said that we may soon be living to be 120 years old. Somebody was talking on the radio yesterday. A lady died 2 days before her 115th birthday. There are currently 70,000 centenarians living in our country, 70,000 people over the age of 100 years old. At the current rate that we have osteoporosis in this country, if most of us begin to live to 120 years of age, we are going to be walking around on eggshells. Osteoporosis can severely affect people's lifestyle. That's why it's important to take care of your health, and particularly your bones, by taking active steps to prevent osteoporosis. And I know there's a large number of people here who are breast cancer survivors. Having a cancer of any kind is a significant risk factor for getting osteoporosis. The sheet that Megan is passing around is a basic comparison of risk factors and statistics regarding osteoporosis and breast cancer. The reason that I'm passing around this information is because there are a lot of risk factors that are similar between the two diseases, but there are also a lot of risk factors that are very diametrically opposed. And in preventing one disease, you can actually cause the other. In this presentation, I want to talk about preventing and treating osteoporosis. For those of you that are not familiar with osteoporosis, it's a disease that weakens bones to the point that even simple everyday activities can cause bones to break. As a nurse, I have taken care of patients with osteoporosis so bad that I broke an arm when I took a blood pressure. I have turned patients over in bed and broken a spinal bone. We have many patients that come in with hip fractures. The question is to determine, did the hip break before or after she fell? Osteoporosis is a very severely debilitating disease. Most of us know very little about our bones. We even take them for granted. Yet our bones provide support and stability for everything that we do. Every muscle strength depends upon the support provided by our bones. While we learn more about bone every day, we don't have all the answers. We do know that 10 million Americans already have this disease, and 18 million more are at risk due to very low bone mass. 1 in 2 women and 1 in 8 men are at risk of suffering an osteoporosis-related fracture in their lifetime. Let me say that again. 1 in 2 women and 1 in 8 men. That's a lot of people. These fractures can cause chronic pain, disfigurement, and even lifelong disability. These fractures, even though they are caused by minimal trauma, are every bit as painful as those fractures that people get in car accidents or rolling down a ski hill. In the United States, there are more than 1.5 million fractures every year. This includes more than 700,000 vertebral fractures, more than 300,000 hip fractures. As a result of an osteoporosis-related hip fracture, 24% of those people will die within the first year after that hip fracture. On your sheet of statistics there, I calculated some figures. If 20% of 300,000 people die every year because of hip fractures, that's 60,000 people per year die from complications after a hip fracture. All of this occurs at great financial and emotional cost to the individual and her family. As a nation, we spend approximately $14 million a year on osteoporosis. One hip fracture costs approximately $32,000. Osteoporosis is a serious and complicated disease that progresses silently and without symptoms or sensation until a fracture occurs. Osteoporosis literally means porous bone. And you can see from this slide, the picture on your right is an osteoporotic bone. There is much less white in that slide. The holes are much larger. And some of the matrix, the parts that hold the mineralization together, are actually missing. This leaves bones weak and very prone to fractures. Like heart disease, osteoporosis goes undetected for many years. Sometimes we are beginning to believe that osteoporosis may begin as early as adolescence. A person may not realize it until she has it until she fractures a bone. At this point, she's probably lost a significant amount of bone, and even routine activities such as lifting a bag of groceries or turning over in bed can cause a fracture. Most people think that bone is hard and lifeless, but in reality, bone is living, growing tissue, and it's constantly being broken down and rebuilt. Special bone-removing cells called osteoclasts remove old bone and create a cavity. Actually looks like a crater in the earth, just like its diagram there. Then the special bone-building cells called osteoblasts fill in the cavity with new bone tissue that uses calcium and other minerals to harden into new bone. With osteoporosis, more bone is removed than is replaced. If the removal of bone occurs too quickly, or if replacement occurs too slowly, bones become less dense and more likely to fracture. We're now thinking of bone as a bank account where you deposit and withdraw. Early in your life, you deposit more bone tissue than you withdraw. As your bones are growing, they increase in strength and density. You will reach a peak approximately 25 to 35 years of age where you will no longer deposit bone, but you will withdraw bone the rest of your life. When you get to menopause, you make a very significant withdrawal within the first 10 years after menopause, because during that time, if you're not taking precautions to prevent it, you can lose 25% of your bone mass during the first 10 years after menopause. Although we all experience some bone loss as we age, not everyone develops osteoporosis and experiences fractures. There are certain factors that increase your risk of having an osteoporotic fracture. That's why it's important to understand your risk and to evaluate your lifestyle on a regular basis. There are some risk factors that you cannot change, and there are some that you can. Some of the most important risk factors for an osteoporotic fracture are traits that you cannot change. Heredity plays a significant role. If your parents or other blood relatives have had osteoporosis, and have broken bones as an adult, you are more likely to develop osteoporosis. And now we're beginning to believe that this may be the most significant risk factor that there is for osteoporosis. If you are thin, have a small frame, or weigh less than 127 pounds, you are also at greater risk for fractures, since people with slight builds generally have less bone mass than people with larger build. Another risk factor that you cannot change is gender. Like breast cancer, osteoporosis affects a lot more women than it does men. Women are 4 times more likely than men to develop osteoporosis, since they generally have lighter, smaller bones. And as women experience menopause, their ovaries stop producing estrogen. Estrogen is a female hormone that helps to protect bone. And as you've probably already heard this morning, estrogen can also cause breast cancer. There are some very old studies where they were using significantly large doses of estrogen to treat menopausal women, in which they were finding lots of breast cancers. Now, where they're using minute doses of estrogen, they're finding a lot fewer breast cancers. So even though estrogen is still first-line treatment for osteoporosis, if you have a significant history of breast cancer in your family, or you have a history of blood clots, we do not recommend estrogen for those people. There are other drugs that we can use to treat osteoporosis that are almost as effective. Race also plays a role, since Caucasians and Asians are more likely to develop osteoporosis. In fact, white women suffer 2 to 3 times as many fractures as African American and Hispanic women. However, keep in mind that while risk may be higher for some individuals, men and women of any age and race can and do develop osteoporosis. Your chances of developing osteoporosis also advance as you age. Essentially, the more years that pass, the greater the amount of bone you can lose. However, osteoporosis is not a disease only of old age. In fact, it can begin at a young age, and bone loss can occur at any time for any number of reasons. I have a friend who works in our densitometry clinic at the hospital, who is 25 years of age. She has been on osteoporosis treatment for 3 years. We found her osteoporosis completely accidentally. We got a new machine. We were testing it out to see if the machine was accurate. When we first tested her, we found that she was missing 20% of her bone mass. We thought it was a mistake in the machine, so we sent her across town and had her tested there. It was not a mistake. And so Nicole has been on treatment for 3 years now. I frequently have a chance to communicate with people across the country that are dealing with osteoporosis. I have been working with a young mother in Florida who has a son who is 7 years old. They don't understand why he's not building bone mass. Her husband, who is 35, has osteoporosis. I received a letter from a young woman in Sweden. Her name is Maria. I'm a 25-year-old female diagnosed with osteoporosis 2.5 years ago. Right now, I'm not dealing with it at all. I guess you could say I'm doing a very lousy job on that account. I was fine there for a while, taking Fosamax, calcium, and vitamin D, doing my exercises and seeing my doctor regularly. I didn't have too much pain either, although I have multiple fractures in my spine. But now my health is getting poorer, and I have severe pain, especially in my hips and legs, and I've been off work for a couple of weeks. She's a teacher. To tell you the truth, I think I'm heading for another depression. I just can't seem to cope with this at all. The change in my life has been so great, and I wonder how I'm going to get through this without going crazy. Thank you for listening. Love, Maria. Your overall osteoporosis prevention program should include an adequate amount of calcium and vitamin D, regular exercise, and a healthy lifestyle to preserve bone health. When appropriate, it should also include bone density testing and medication. While you cannot change your genetics or heredity, skeletal frame, gender, race, or age, you can control other things. If you currently smoke cigarettes, now is as good a time to quit as any. Smoking is very harmful to your bones. Research studies have shown that women who smoke are much more likely to experience an osteoporotic fracture than women who do not smoke. Furthermore, smokers tend to go through menopause 2 to 3 years earlier than is normal, which would be favorable to preventing breast cancer. If you have tried without success to give up this habit, speak with your doctor about the different aids that are available to help you with this very difficult task. There are lots of programs available through either hospital, and there's also many aids out there to help people stop smoking. Alcoholism or excessive alcohol intake can increase your risk of an osteoporosis-related fracture. Several ounces of alcohol daily can interfere with calcium absorption and damage your bones. Not only does alcohol absorption change how you absorb calcium and vitamin D, it also is toxic to those bone-building cells called osteoblasts. You can also ensure that you're getting enough calcium in your diet. Calcium plays an extremely important role throughout life in the development and maintenance of bone. Calcium is stored in the bones and is used by the body for a variety of functions, such as regulating heart rate and blood clotting. About 98% of the calcium that's in your body is in your bones. The rest of 2% is circulating throughout your body. If the circulating 2% becomes low, it will rob it from your bones. A lack of calcium increases your risk for osteoporosis, but calcium intake is only one factor. You need to consider all the factors when assessing your risk of osteoporosis. If you have an inactive lifestyle and don't exercise regularly, your chances of being affected by osteoporosis may increase. Your bones function much the same way as your muscles do. The more you exercise, the stronger they become. And if you're exercising, you're also helping yourself prevent falls, which can cause fractures. For women, the hormone estrogen protects against bone loss. After menopause, a woman's estrogen production decreases, potentially leading to rapid, irreversible bone loss. A woman who experiences an early menopause may be especially prone to osteoporosis, since the protective effect of estrogen is lost earlier in life. And not just during menopause. Anytime a woman is without periods, she is putting herself at risk of bone loss. So these young women that you see in the Olympics that are competing very heavily in exercise, that are amenorrheic or they're not having menstrual periods, are putting themselves very much at risk for losing bone mass that they may never be able to recover later in their lives. Other risk factors that put you at increased risk for an osteoporotic fracture include overall poor health, dementia, a history of frequent falls, and impaired eyesight despite adequate correction. Also, prolonged use of certain medications can increase your risk for osteoporosis. These include certain anti-seizure medications, glucocorticoids or steroids, such as prednisone and cortisone that may be prescribed to treat asthma, arthritis, and cancer. Excessive thyroid hormone may also increase your risk. If you're taking any of these medications, you need to discuss with your doctor your concerns before changing or discontinuing any medicines. Anytime a doctor puts you on a regimen of medicine, you want to check with him before you stop. Sometimes stopping the medication can have more drastic effects than talking to your doctor and gradually tapering off the medicines. Use of glucocorticoid medications is the #1 cause of secondary osteoporosis. These drugs are frequently used to treat cancers of various forms, not just breast cancer. Also, some chemotherapies can cause bone loss. They cause nausea, vomiting, diarrhea, mouth sores, loss of appetite, and changes in nutritional status. They cause change in kidney function, which can cause an increased calcium excretion in your urine. They also cause changes in your liver function, which can cause changes in vitamin D absorption. Vitamin D is absolutely necessary for calcium absorption. And they can Chemotherapy drugs can also be toxic to the bone rebuilding cells, the osteoblasts. Now that you know what the risks are for osteoporotic fractures, you can evaluate your risk and take immediate action to protect yourself against this disease. Taking steps now to prevent osteoporosis will help you avoid the fractures, chronic pain, and potential disability of osteoporosis later. It would be an incredible shame to survive breast cancer only to succumb to osteoporosis. Patients in this situation may have to forego their independence, relying on family members or others to help them with everyday tasks. This dependency often puts an added strain on the whole family. Of those 300,000 hip fractures, the 240,000 that survive the first year after a hip fracture, 30% of them will end up in a nursing home. So you will find another 80% of those people in nursing homes. It's not surprising that many people with osteoporosis suffer from depression due to their dependence on others. When a person goes through a diagnosis of osteoporosis, I know my friend Nicole has had 5 fractures in her lifetime. She's 25 years old. 3 of those fractures have occurred in the past 3 years. She at this point has given up rollerblading, she's given up skiing, she's given up a whole lot of things because she's afraid to fracture. And as people become older, they get afraid to go out. They become very lonely. And it's not surprising that they have severe cases of depression. The first thing you can do to build the strongest bones possible before you reach adulthood, for most of us, it's too late to do that. The stronger your bones are at peak bone mass, the more bone you have to sustain as you grow older. At this point in time, most of us will not have a chance to measure our densitometry at peak bone mass, which is when we really want to know how much bone have we got. Right now, Nicole is about 18% from peak bone mass, and that's why she's on medication, because she should be within 5% of peak bone mass. To build strong bones, you need to get enough calcium. Calcium is important for maintaining bone and preventing fractures. Yet national surveys have shown that many people consume less than half of the daily recommended amount of calcium. I have been doing a lot of osteoporosis education among teenagers. One of the things that we are noticing is that less than 13% of teenage girls get the daily amount of calcium that they need. Less than 13%. Generation X is going to be walking on eggshells before they are 40 years old. Calcium needs vary according to age and health. The National Academy of Sciences recommends 1,300 milligrams for teenagers. Most of them get less than 800 milligrams. 1,000 milligrams for individuals ages 19 to 51, and 1,200 milligrams for everyone over the age of 51. And if a person is not taking estrogen, they should be getting 1,500 milligrams. To increase the calcium in your diet, you can eat low-fat or non-fat calcium-rich foods such as milk, cheese, and yogurt. Dairy products, as much as many of us hate to admit, are still the best natural source of calcium that we have. Salmon and broccoli are other good sources of calcium. I have a slide that I show children when I talk to them. It would take just about a bushel basket full of broccoli every day to get enough calcium daily. It would take 1 cup servings of broccoli a day. How many of us eat that much broccoli? And even salmon, unless it's canned with the bones in it, does not have much more calcium in it than broccoli does. So if you're unable to get enough calcium in your diet through foods, you need to add a supplement. And there are lots of good supplements on the market. There are a few back there on the table. If you are lactose intolerant, there are lots of products on the market that are lactose free, but you have to carefully read the labels because a lot of them have absolutely no calcium in them at all. Some of them are touted as soy milk. If you read the label, there may not be any calcium in that product at all. So if you're using a dairy substitute, be sure you read the labels. There are also products such as orange juice and cereal and waffles. They're trying to get calcium into kids, so they're fortifying cereals and waffles and things like that with calcium also. The other thing you want to be aware of is if you're taking supplements, don't take your whole daily supplement at the same time because your body can't absorb that much. You also want to be sure that you don't take your calcium with things like iron because calcium will block your iron absorption. You want to be sure you don't take your calcium with a high fiber muffin because the fiber will block your calcium absorption. And you also want to be sure that you get enough vitamin D. Vitamin D plays a significant role in the absorption of calcium by the body. The relationship between calcium and vitamin D is similar to that of a locked door and a key. Vitamin D is the key that unlocks and opens the door, allowing calcium to enter the bloodstream. Experts recommend a daily vitamin D intake of between 400 and 800 international units. If you are postmenopausal, you need closer to 1,000 international units. Vitamin D is formed naturally in your body after exposure of bare skin to sunlight. In northern hemispheres where we sometimes get no sunlight for months at a time, approximately 95% of the population is vitamin D deficient. The only other good source of vitamin D is through milks that are fortified with vitamin D. The rest of us need to be on a supplement. And if you're one of those people who doesn't exercise regularly, osteoporosis offers yet another reason for you to become more active and start an exercise routine. This doesn't mean that we all have to go out and do aerobics. 30 minutes of walking a day is enough to help you prevent osteoporosis. Weight-bearing exercises can help build and maintain strong bones and improve balance and flexibility. Weight-bearing exercises like walking and jogging force your muscles and skeleton to work against gravity, unlike swimming where the body is buoyant in water. We had a patient in the hospital recently that had osteoporosis so bad that we couldn't stand her up. Every time she stood up, she fractured another vertebra. So what we had to do was put her in the pool, and because the pool was holding up part of her weight, we started her on exercise that way. Other weight-bearing exercises include weight training, racket sports, hiking, dancing, stair climbing. Any exercise where you are holding your weight against gravity is a weight-bearing exercise. Exercise can also help you improve your overall balance and strength. Be aware that the bone strengthening benefits of exercise last only as long as you keep up with the exercise. For those people that are on bed rest and for those people who are up on the space station, they have had to install exercise machines for those men because people on bed rest and people who have no gravity sustaining abilities will lose bone mass, as much bone mass in 2 weeks as a normal person would lose in 2 years. So when those astronauts go up for a 2-week stay, they need to have some kind of exercise program because they can lose 2 years of their bone mass, which could amount to as much as 5%. So you need to talk with your physician about osteoporosis. If you haven't considered your risk for this disease, now is the time to take action. Your doctor can determine if you already have or are at risk for developing osteoporosis. During your visit, your doctor can review your family history and risk factors and decide if you should have a bone density test. At this point in time, the Osteoporosis Foundation is recommending that everyone have a baseline densitometry done before you go through menopause. After that, you should have one done about every 5 years unless you have documented bone loss. So if you go in and you are like at 90% this year, you might want to go back in 2 years rather than in 5 years to determine how fast you're losing that bone mass. So that if you need to be treated, you can be treated sooner rather than later. And if you have a physician that you have tried to approach about osteoporosis and he doesn't want to listen to you, he doesn't think that it's one of those things that happens when you get older and there's not anything that we can do about it now, find yourself another physician. Some of the physicians are still of the mindset that this is just an old woman's disease and there's not anything we can do about it, unfortunately. A bone mineral density test, also known as a BMD test, is a simple and painless way to determine the mass or density of your bones at the spine, hip, wrist, finger, heel, kneecap, or shin bone. There are lots of different tests out there now. The ones that you see in the drugstores and around town, there are peripheral screening tests that scan your heel with ultrasound, are just that. They are a screening test. They will not tell you what your risk for fracture is at your hip or your spine, which is where most fractures occur. They will tell you, however, if you may be prone to low bone mass. If you are one of those people that comes in with a low reading on a heel scan, you want to have your density checked on a central densitometer, which will measure at your hip and at your spine. A lot of times we get false positives from the ultrasound machines. People will come in and they'll have a central DEXA done, and we'll find that there's actually nothing wrong with their bones at their spine or their hip. And the reason for that is because although the bone in your heel is the same kind of bone that is in your hip or your spine, the bone at those other two locations can be very different. Sometimes we'll have patients that come in with a very low spine reading, but they have a very good hip reading. And so we want to help those people prevent fractures at the particular site that they might be at risk to fracture. The Osteoporosis Foundation has recently published a physician's guide to prevention and treatment of osteoporosis. Bone mineral density testing should be performed on postmenopausal women under the age of 65 who have one or more risk factors for a fracture. All women age 65 and older, postmenopausal women who have a fracture, women who are considering therapy for osteoporosis and would like testing to help them decide, and women who have been on hormone replacement for prolonged periods, because we don't want to leave people on hormone replacement for prolonged periods of time. We want to be able to get them off of it. On July 1, 1998, bone mass measurement testing became available to millions of Americans. Medicare now covers FDA-approved bone density technologies for individuals in one of 5 categories. An estrogen-deficient woman at clinical risk for osteoporosis, an individual with vertebral abnormalities, such as those showing up on an X-ray of the spine. People with vertebral abnormalities that show up on an X-ray of the spine generally will have approximately 30% bone loss. Any individual receiving long-term steroid therapy, such as prednisone or cortisone, an individual with primary hyperparathyroidism, or an individual being monitored to assess the response to an FDA-approved osteoporosis drug therapy. Now, with this last one, the very strange thing about that is that they will pay for subsequent densitometers, but they will not pay for the one that gives you your diagnosis. Combining all of these steps, getting plenty of calcium, vitamin D, and weight-bearing exercise, making healthy lifestyle choices, including not smoking and not using alcohol to excess, and talking with your doctor will help you maintain your bone health. If you have low bone density or osteoporosis, your doctor can prescribe treatment with either estrogen, alendronate, calcitonin, or raloxifene. There are also some treatments out there that are not FDA approved yet, but which we are expecting to come out within the next 2 years. Many physicians prescribe estrogen replacement therapy at the time of menopause. Estrogen is a good way to stop the bone loss that occurs following menopause. For those people at risk of breast cancer, if you have breast cancer in your family and your physician suggests you use estrogen, please be sure and let him know that you do have a history of breast cancer because there are other treatments that are effective. Research has shown that estrogen reduces a woman's risk for hip fracture by 50% and also reduces her risk for fractures in the spine and other bones. It also appears to reduce her risk of heart disease. There are benefits and risks associated with estrogen, including an increased risk of breast cancer and endometrial cancer when used long term. That's why we want to get people off of the estrogen if they've been on it for a while. Women who still have their uterus can protect the endometrial lining by taking a second hormone, progesterone, in combination with estrogen. This combination is referred to as hormone replacement therapy. Both estrogen and hormone replacement therapy are effective for treating osteoporosis. Alendronate, or Fosamax, is another medication that is prescribed for both the prevention and treatment of osteoporosis. In addition, alendronate recently received approval for treatment of steroid-induced osteoporosis. Alendronate is a medication from a class of drugs called bisphosphonates. Right now there are about 9 more bisphosphonates that are currently under research. There has been a second bisphosphonate recently released in January called risidronate that also has been shown to increase bone mass and prevent fractures. However, they do have their drawbacks as well. If they are not taken regimentally, they can cause stomach disorders like esophagitis. They can actually wear holes in your esophagus. And so people are told to take these drugs with a full glass of water when they first get up in the morning. You don't go back to bed. You need to remain upright so that it doesn't slosh back in your esophagus. And you cannot have any other food or beverage in your stomach other than in water. So what we like to recommend is that you get up in the morning, you take your Fosamax with a full glass of water, you have your shower, you take your dog for a walk, and you come back and you have a healthy breakfast, and you've had your osteoporosis treatment for the day. Calcitonin is a naturally occurring hormone that prevents further bone loss. It's now approved by the FDA for treatment of osteoporosis. In research, calcitonin appeared to slow bone loss, but much less so than estrogen or Fosamax will. The added benefit with calcitonin is that if we have a patient in the hospital with new fractures, giving them calcitonin can help relieve some of the pain from those fractures. Calcitonin, however, has very few side effects because it is a natural hormone. It is given through a nasal spray, and consequently the only side effects are irritation at the nose. Raloxifene is a medication that Dr. Hunt was talking about this morning. It's called a selective estrogen receptor modulator, a SERM. It's approved by the FDA for prevention and treatment of osteoporosis. Raloxifene appears to have the cholesterol-lowering and bone-beneficial effects of low-dose estrogen without the possible increased risk of breast cancer. Possible side effects include hot flashes and blood clots, just as she was talking about this morning. In addition to these FDA-approved medications, researchers are working on other treatments. Right now, there's a lot of research out that indicates that parathyroid hormone may actually help us rebuild bone mass. And the benefit of parathyroid hormone is that it would not only help us remineralize bone, but it would help us rebuild the matrix that's lost. Parathyroid hormone regulates how fast your bones are built, how thick the matrix is, and how much they are mineralized. And when it's taken to excess, as in a person who has hyperparathyroidism, then it tends to cause the bones to be destroyed. but taken in small doses, it's very beneficial for building bone mass and bone matrix. Most of these other drugs will slow bone loss, but they don't rebuild the matrix. And so the discovery of parathyroid hormone has become very important. If you have osteoporosis, changing your environment can reduce your risk of falling and suffering a fracture. We always recommend that people remove household hazards by anchoring rugs, avoiding slippery floors, using treads on stairs and handrails on staircases, installing grab bars and non-skid tape in the shower and tub, and placing non-skid rubber mats near the sink and stove. Other useful suggestions include minimizing clutter, removing loose wires, improving lighting in halls and stairwells, and using night lights throughout the house. To improve balance and reduce risk of falling, you should wear sturdy, low-heeled, soft-soled shoes and avoid sloppy slippers and sandals. Be aware that some medications might cause dizziness, lightheadedness, disorientation, or a loss of balance. Ask your doctor if any of the drugs that you are currently taking may have any of those side effects, and also remember to have regular eye and ear exams. To help make the physical impact of osteoporosis more real, I'd like to introduce you to Linda. Linda is shown at the age of 45 on the left and age 70 on the right. During these last 25 years, we have learned how to diagnose osteoporosis and have several medications to slow or stop bone loss and reduce fracture risk. With proper diet, exercise, and medications, Linda likely would have avoided the many spinal fractures that caused her loss of height, curved spine, chronic pain, and loss of independence. So remember, the choice is yours. Take steps today to protect your bones for tomorrow. And this is information on contacting the National Osteoporosis Foundation. They do have a website. It's www.nof.org. Any questions? Yes?
When I first started looking at taking calcium, and that was a while ago, I read somewhere that there were different forms of calcium. I think one was calcium carbonate and the other one calcium citrate. And it said not to use calcium carbonate because it wasn't absorbed as well in the bone. Or it wasn't absorbed. Or maybe, but anyway, now the things I'm seeing by accident, if you read the label on those, it's calcium carbonate.
Yes.
So I wondered,
There's a handout on the back table that talks about calcium supplements. There are many supplements on the market. The things you want to avoid are oyster calcium, because it can contain lead. As far as other things, there's not a lot. The supplements will vary in that people who take calcium carbonate will frequently report a lot of gas, and that they can't tolerate it because it upsets their stomach. If that's the case, go on to calcium citrate. Calcium citrate produces much less gas and it's much more tolerable. You just want to make sure that you're getting enough because different medications will have a different amount of elemental calcium in them. And the reason that they recommend calcium carbonate is because it has the largest amount of elemental calcium in it. Yes?
Is it effective in addressing bone damage or only during treatment?
Both. Depending on how much bone is lost, if the matrix is lost, that's a forever thing. If it's just mineralization can be replaced. That's what these drugs are doing. They're slowing the bone loss, but actually what they're doing is allowing the mineralization to increase. And that's why we're seeing increased bone densities. But they can't replace the matrix that's lost with bone loss. Yes?
My doctor told me to take boron along with my calcium. Do you know anything about that?
I don't.
It's evidently, what I understood was that it directs the calcium to the bone better.
Does it have vitamin D in it?
You can get it with vitamin D
I usually take my calcium.
A lot of the calcium supplements now are coming out with vitamin D in them. In this hemisphere, they are very much recommended. There's also calcium supplements that have soy in them. Soy is a natural estrogen. I don't know how natural estrogens would relate to breast cancer.
There's current studies being done about the relationship of osteoporosis and breast cancer. And is there a direct relationship?
Well, through all the research that I did for this conference, I could not find anything that directly related the two, other than the fact that we know that chemotherapies can cause bone loss. And we know that steroids that are used for treating cancers can cause bone loss. And the fact that some of the risk factors for the diseases are equal, while some of the risk factors are diametrically opposed. So that when you're trying to treat one disease, you can actually cause the other. Yes? Not necessarily. If you're getting a basically healthy diet with lots of calcium in it, and you're not overdoing the fats, and you're not overdoing the proteins, you're also protecting yourself against the cancer. Milk products now are coming in very low-fat varieties, including skim milk, which is non-fat. But then there's been lots of information today about diatoms that are coming through the food chain. Yeah, and if that's a problem for you, go to the soy milk. Yes.
What age should a young woman start taking calcium before she has menopause?
There is a study out that was done by the National Institute of Health and one of those government agencies that relates to children's health. They started giving 14-year-old girls 300 milligrams of calcium a day. They increased their bone mass 15%. That's very, very statistically significant because for every 5% increase in bone mass, you have a 40% decrease in fracture risk. So yes, children, if they're not getting the calcium that they should be, there's lots of supplements that they can be on to increase their
I
calcium.
was thinking like about a 35-year-old or just at that age.
A 35-year-old,
35 to
anyone who's not getting their recommended daily allowance of calcium should be either working with their diet to increase that absorption, or they should be working on supplements. Yes?
How much calcium is estimated in breast milk?
I don't have that. Children only need like 500 to 800 milligrams, depending on how old they are.